Welcome back. Episode 11, Rohrich Knose, where we're helping you be a better you. And we are very honored today. I am honored today to have one of my closest great friends and one of the most amazing people I know in all of medicine and in plastic surgery. And guess what? He's a plastic surgeon too. Dr. Robbie Pearl. Welcome.
Thanks, Rod. It's wonderful to be here in Dallas, Texas.
It's amazing. Now, Robbie is, he's kind of a Renaissance man. He's a plastic surgeon. He is a business guy. He's been the CEO of Kaiser Permanente, one of the largest and most amazing healthcare groups in all of the U.S. and California. And he's a plastic surgeon. Now, what a unique combination is that? And now he's a global figure. He's written several best-selling books. We're going to talk about several of them in his new book as well. And he also gives back. He teaches. He's got dual appointments in both medicine and business at Stanford.
Yes.
And he's a full professor, clinical professor of plastic surgery there. So, and he commutes weekly. He just told me right from New Haven,
Yes.
Yale, and amazing. So, I love people with energy. And when I meet and know somebody with energy, I can feel it, and that exemplifies Robbie Pearl. So Robbie, welcome.
Thank you again. It's wonderful to be with you again, Rod. It's been a while.
Yeah, it's been a while. But
COVID's kept us apart.
Yes, I know. Well, we're getting back. And I would say that Robbie is a passionate realist. He knows medicine and he's not also ashamed to talk about the good and the bad. In fact, that's how he wrote this best-selling book. And honestly, when I read it, it kind of says the things that we as physicians have always known. And even though, medicine is the greatest profession and it's something that, it's changing. Everything's changing. And we're going to talk a little bit about that. So Robbie, tell me a little bit about why did you write your first book on Mistreated?
I've been thinking about three questions for probably a decade, Rod. The first one is the United States spends twice what any other nation does. We spend $11,000 per American on healthcare. Switzerland's 9, Germany's 7. Everyone else is less than 7, half of what we spend. Right. And according to the Commonwealth Fund, we're last in clinical quality. Life longevity, we're last. Childhood mortality, we're the highest. Maternal mortality, more deaths than any other country. How is that possible?
Right. We're one of the wealthiest countries in the world.
And we spend so much. We spend more on healthcare than the entire nation of India with 1.2 billion people, or France. If you count their truffles and their champagne, we still spend more. They spend on everything. How is this possible that the results could be so problematic? Second of all, every other industry has used technology, robotics, AI, computers, data analytics to increase quality and lower cost. Healthcare, we've seen quality go up a little bit and costs go up a lot with technology. How's that possible? Right. And as you say, being a doctor is the best thing you can possibly be. And yet we know that 44% of physicians are burned out, despite having the privilege every day of saving human life. So I wanted to understand these things. And The first book, by the way, all profits from both books go to Doctors Without Borders. So It is a labor of love. But Mistreated was about the system of medicine. Right. And I concluded after a lot of research, we're a 19th century cottage industry. Right. We're fragmented. Doctors scattered across communities, not communicating with each other. We pay people on a piecemeal basis. We call it fee for service. The more you do, the more you get paid. Whether you adds any value, create an error, you often get paid twice. Right. We use technology from the last century, although actually the century before, because the fax machine is how doctors exchange information, an 1843 invention. And today we still get faxes. Exactly. And of course, there's no leadership structure. How is it possible we have this leftover 19th century? So that was Mistreated. My new book is called Uncaring. Right. The culture of medicine. And that just came out. Kills doctors and patients. Yeah, it came out 3 months ago. Yep. And it's a look at the other part, because it was very clear to me that there had to be more than just the systematic problems. December 2019, 4 months before coronavirus comes ashore, the federal government releases a report. Healthcare costs are going to go up 5 to 6% a year, every year for the next decade. You do the math, compound interest, it's $2.5 trillion every year And no one seemed to pay any attention. How is that possible? So that was the research that I did. It's what drove me to research and write both books.
Yeah. So Robbie, you've told us all the problem, and you're a problem solver. So what's the solution? I mean, in medicine, we are so focused on, becoming doctors, learning to be experts in our field, and in medicine and in surgery. So few people, so few physicians really grasp and use the technology. Why is that? I mean, we're taking care of patients. We want to do the right thing, but why are we laggards compared to other industries? When we have some of the best people, I mean, obviously I'm biased in medicine. Why are we the laggards?
I'm sure you're very familiar with the caduceus, these two snakes that wrap around the staff that doctors wear on their. So one snake to me is the system of medicine, and one snake to me is the culture of medicine.
Right.
So the part of the problem in the system of medicine is technology has some limitations. Let's take telemedicine. We'll talk a lot about that today because I believe it's the future.
Right.
But if you look at telemedicine, we had problems with interstate licensing. You're in Texas. If someone from Oklahoma comes to your office, you can take care of them. If you connect virtually on telemedicine, you're not allowed to because you don't have a license in Oklahoma.
Right.
It's a crazy system. We didn't pay for it, even though it was higher quality, more rapid access, and lower cost. These are the systemic problems. But there's also the cultural ones, which that much of the technology, telemedicine is a great example, undermines what we as doctors value.
Right.
Culture is about values, beliefs, and norms that are sitting in place. And again, it also goes back to history. There's a physician, Hermann Boerhaave.
Right.
He met an individual named Daniel Fahrenheit. We named the temperature after him. He invented this device that can measure the human temperature down to 1/10 of a degree. And it would be 100 years before physicians would use a thermometer because their hands able to detect temperature, even if it wasn't exact. They valued that. That's what made them special. What's the problem with telemedicine? We love our offices, even if it's hard for patients to get there, inconvenient, even if it limits our practices to a small geography. That's the culture.
But at least I think, COVID came, and hasn't that transformed telemedicine and actually almost immediately made it from kind of marginal to the standard of care?
Absolutely. As you know, Rod, we were using it less than 5% of the time, and then it soared to 60 or 70%. Now it's started to slide back. So we'll have to see where it goes. And I think that's a cultural issue as well as a systemic issue that's there. But that's why I say it's now opened the door.
Right.
Because there's no one out there. I mean, you're a world famous plastic surgeon and people fly in to see you all the time. Right. But most people don't have that privilege. But why should we be limited by the little community we're in? Why can't we provide our expertise to people 100 miles away, 1,000 miles away, even 10,000 miles away? And by the way, they can then provide the expertise to Americans, something that was inconceivable 2 years ago.
Right.
And now I think it's literally on the doorstep.
And I think, so that's been one of the good things about COVID, because also it forced companies, insurance, and all of us to say, hey, and even states almost immediately, it was okay to do telemedicine. And people would now be able to do it, get reimbursed for it. Before it was like hands off. And now it's actually it's really almost become the standard of care. And I use it all the time. To this day, I probably do 3 or 4 telemedicine or virtual consults a day. And actually, it's far more efficient because you're right. These that come from LA and New York, I mean, that's not necessary, at least in the screening process. So exactly. I think it's good. And then for the regular medicine, it's unbelievable.
Yeah, to me, telemedicine has a variety of opportunities. Number one, no one should think about it as just a replacement for the office visit. This is a remarkable tool to bring doctors together, because if there's someone seeing a patient in the office with a plastic surgical problem, why should they have your expertise while the patient's still there? Why tell the patient, call Dr. Rohrich's office, make an appointment, wait 5 days? How do we bring Dr. Rohrich right into that office? Telemedicine accomplishes that for us. It creates the opportunity for a group of physicians to provide care to a group of patients without having to all be in the same building. I mean, a lot of practices, Kaiser Permanente, we had 10,000 physicians, and they'd work together as one and they could cover for each other. But most medicine in the United States is delivered by doctors in offices. And how do you bring them together? Now, why is that important? Well, think about this. The typical doctor is 5 o'clock, 6 o'clock at night. If you call the office, they're not open. What do they tell you to do? Go to the emergency room. That's the last place you want to be, Rod.
I know.
If you're having a heart attack or a stroke, it's the first place you want to be. You don't want to be there, but it's where you should go. No, if you're having a regular problem, they don't know who you are. They'll never see you again. Right. They can do a lot of testing. It's a remarkably inefficient and not high quality experience. Telemedicine allows 20 of us to get together. We each take one night. And now at 2:00 in the morning, if your kid has a fever of 103, you're not sure what to do, you can see a physician, provide care right away, higher quality, better service, lower cost.
So we've been fast forwarded to do that, and it's been made legitimate with during the COVID era. How do we keep it that way? How do we sustain that? I mean, isn't that the $1 billion question?
Well, I think the question you started to raise earlier, which is how do we address the totality, both the system and the culture?
Right.
My answer is the first thing we have to do is to move from fee-for-service to capitation, to prepayment. Take a bunch of physicians, put them together with a hospital and a set population, connect them obviously with technology, and now pay them a set fee to provide care and measure the quality in the service. Now, why do I think that's so important? Because it moves not just the care experience, but the culture. Because when you're prepaid in a capitated way, you try to avoid problems. You start elevating prevention. You start saying what we should be saying in plastic surgery. Who does enough cleft lip to get really great results? And who does enough hand surgery to get really great results? And who gets enough breast surgery to get really great results? And how do we take the totality of a specialty and bring it together in a unified way? Telemedicine accomplishes that.
Yeah. But when you mention capitation to doctors, it's kind of a reflex going, oh my God, I'm going to go down in my salary. It's going to really, I don't get it. I don't understand it. So what do you you're a world famous physician. So how do you tell a plastic surgeon that we're going to go to capitated care for reconstruction?
Well, that's another thing that COVID has helped us with, because the people who were not capitated during COVID, particularly the specialties like orthopedics, where people had a lot of flexibility about the timing, they watched their incomes plummet in half. The people who were capitated, they did really well, because not a whole lot of patients came in because they didn't want to get COVID unless they were quite sick. So they saw the opportunity that sits there. I think it's more than just the economics, though. That's why I wrote the second book on caring, because it's also about doctors coming together and working together. And what do we value? Our independence, our autonomy.
Right.
We value the uniqueness of I. And instead, I think in the 21st century, we need to move to this we way of providing care. And when you start to do that, it starts to make sense. Second problem, we don't like to be ever told what to do. We don't like leaders being able to define the things. We want that independence, and that's the culture.
Yeah.
And I think that's the biggest hurdle. And at some point, we have to therefore develop leadership and find ways to organize it. And my belief is, and my experience has been, that when you do that, physician satisfaction goes up, patient quality goes up, patient satisfaction goes up, and costs come down. About 20 years ago, I was in the Oregon Health Sciences building. When you walk through the door, there was this sign. It said quality, service, and cost in big letters across the top. And the bottom it said, pick any two. That's the mentality of the 20th century.
Right.
When you're in the 21st century, between the technology, between the organization, between the operational improvements, you can do, I believe, all three. It's going to be a little bit like Roger Bannister. I mean, remember, when he ran the 4-minute mile, everyone said it was impossible. He was a doctor, by the way. I'm sure you know that.
Yeah.
And within 2.5 years, 10 of the people had done it. Once they start to see people being able to achieve these results, we're more satisfied, more fulfilled. I mean, you and I both do a lot of missions to other countries, fixing children with cleft lip and cleft palate and other problems. You're there for 10 days. You work 12 hours a day. It's boiling hot. You eat rice and beans. You have GI upset. And you come back so fulfilled and satisfied. That's so important. And I think when people see that in medicine, which they can see as they improve the health of patients and they meet their needs, I think some of the historical dissatisfaction you're describing goes away. At least that's my hope, Rod.
Yeah. So how do we do that in this country? I mean, how do we accomplish that? Because, it's care is segmentally different in every Texas, California. I mean,
I think there's a possibility it's going to happen in the post-COVID period. I mean, the federal government most likely will have borrowed about $8 trillion that has to pay back with interest. The states, as you know, by the law, have to have balanced budgets.
Right.
And they're going to have higher Medi-Cal costs. They're going to have higher unemployment. And the small businesses, they're the ones who really suffered.
Right.
The big businesses did fine. The small businesses, a lot went out of existence, but a lot of them suffered. And I think they're all going to be looking for ways to lower their healthcare costs. So I think one way it can happen is through the businesses who are, we've said for a long time, we can't afford it. Now we really can't afford it at that level.
Right.
And when they start to say, you've got to do it differently, the first thought will come around capitation, because that's really the only way to limit cost. If fee-for-service, you can lower price and people just do more. Right. So as capitation starts to work. The second way I think that it could happen, and we're starting to see this, by the way, a lot of entrepreneurial startups are existing, particularly with primary care physicians. And they're tired of being at the bottom of the pecking order.
Right.
And they're saying, we want to be able to take the inefficiency of the ERs, the hospitals, and the doctors out of the system. So one possibility will be these primary care groups that will now start to provide the care, but they're not going to be done providing the care, because then what they're going to start to say is, well, why don't we hire some specialists to help us?
Right.
Not every doctor in the community, not a broad network of every orthopedist and plastic surgeon, but how do we pick one or two people who we think are the best at getting the highest quality, the best service at the lowest cost? And so that could drive the process. The third way it could happen is through a completely outside organization. To me, the quintessential organization is Amazon. I mean, Amazon, JP Morgan Chase and Berkshire Hathaway came together to form Haven 3 years ago. And at the time I said to people, anyone who believes that Bezos is doing this just for his employees as a not-for-profit, which is what they said, probably is convinced that Amazon only sells books. Right. No. This is going to be, he has 1/6 of retail. He wants 1/6 of $3.5, now $4 trillion of medicine. And I think that organization could do that. And for the plastic surgeons listening in or the doctors listening in, don't think that they have any intention of having everyone part of the process, every hospital. Right. No. This is going to be putting together a delivery system designed around the customer. And I don't know which of those three will happen, but I think it's inevitable. And if it doesn't happen now or the next year or the year after, it has to happen, because we can't spend $2.5 trillion more over the next decade. It simply is not going to be affordable for the United States. It will destroy our economy, our global positioning. Right. No, it's not going to happen.
So I like that, Robbie, but it's the physician buy-in. I mean, and I think we need to have, physicians can't just be Amazon. It's got to be physicians leading physicians. Otherwise, it's not going to work. It's going to be people like you. But so how do we do that? How do we, get the next millennials and everybody else saying, okay, this is a good idea and it's really going to fulfill me, as a physician? Because that's really what it's all about. I mean, how do you do that?
Well, it's why I wrote the books. I mean, I think to try to educate people. It's why both you and I will be speaking at the plastic surgery meeting. Right. It's letting people become aware and opening their eyes. As you say, physicians in general are smart, and I'm very biased like you. Plastic surgeons are very smart. And when they look at the data,
we're very focused.
When they look at the data and they look what's going to happen, at some point they're going to say, this is not sustainable across time. And when we know from business, everyone could do an Amazon model. Why is Amazon so successful? Because it was the first mover.
Right.
And there will be people, there'll be energetic people early in their practice who are going to say, we can do this differently. We can be the technological solution. And I think, as I say, when some people do it, others will follow along. But it's going to be like the 5 stages of grief in Kubler-Ross. First doctors are going to be in denial, which right. They are. Then they'll get angry, all capital letters with exclamation points about why this is a terrible thing to have happen. Yeah. Then they'll bargain, which you're already seeing, by the way, people selling their practices to right. Private equity and to right. other companies. Then they'll get depressed, which is my big worry. Because I think that
we may be in that phase now.
We are. Well, we're in all these phases right now, but finally they get to acceptance, which is not what they want. But they say, I really don't have a choice. And that's when we'll move, I think, from 20th century medicine to 21st. And when it happens, I think it will happen really quickly.
I agree. Well, I know Amazon, when you listen to Bezos, and, what's different is that he wasn't concerned about any other company. He was concerned about the consumer. So if we as physicians, and, that's our Hippocratic oath, if we're concerned about our patients, we have to find a pathway that's going to give best care, because, you're right. Globally, America is, very wealthy, but we always get criticized, like you said, because we don't necessarily give best care. I mean, we can get best care, but we want to make everybody get best care. And I think your solution is a good one. So what are some of your closing thoughts on how that's going to happen and when?
I think it's going to happen probably somewhere between 5 and 10 years from now. I think it's going to happen out of the economic crisis that exists. I think it's going to happen when people say, I'm just not going to keep paying for more and more and more at higher and higher prices. I often speak to CEOs of major companies. I always ask them, I said, how many of you have remodeled your kitchen or your bathroom? Every hand goes up in the room. I said, how many of you paid the contractor? Say, do whatever you want. I'll just pay time and materials. No one. And it's not money. It just doesn't make any sense to say that because you're not going to get what it is you most need. And unfortunately, I think that's true. I think physicians are incredibly hardworking. They're very dedicated. They don't do any of this intentionally.
Right.
But I think the system and the culture drives them there. And I believe, Rod, that once they experience that opportunity to value keeping the patient maximally healthy, maximally fulfilled, maximally satisfied, they're never going to want to go back to the system before. I think the burnout ties into that. We can talk about that in the next episode.
Right. I agree. Amazing. Well, this was phenomenal. And it's a revolutionary approach to what is really medicine next. So please follow Robbie Pearl, and you have your own podcast. And of course, he's a regular contributor to Forbes. I see that all the time, and he travels around the country. So Robbie, tell us about your podcast and where people can find you. And
the best place to get information on all these topics is my website, which is robertpearlmd.com. And going there, you can find information about the Forbes articles, the podcast. I have 2 podcasts, Coronavirus, The Truth. That's twice a month. It'll be coming out tomorrow night, Sunday night. I don't know what night day you're going to publish this.
Yeah.
Okay. And then Fixing Healthcare, in which I interview a variety of people on a various set of topics. The current season, I'm looking at the big players. I've had the head of the AMA, the head of the American Nursing Association, head of the American Hospital Association, and I'm going to have a variety of other big famous names coming on the show to tell me why they think they can solve the problem. And then we'll have the chance at the end to summarize about who's most likely to be right and what are the alternatives to the solutions they present. Fixing Healthcare, and it will be published as well this week.
Wow. Congratulations. Thanks, Robbie.
Thank you, sir.
Amazing.
My pleasure.
That was great.